An emerging modern problem is text neck. I know. But that's really the world we're living in. It doesn't matter if we're doing a manual job, a stationary job, if we're a recreational person, if we're not a recreational person, all of us are spending way too much time looking down at our phone. But there's literally now becoming very defined symptoms around text neck. Sharp nagging pain that radiates across both shoulders, headaches because of the compression in the muscles of the neck, because of all these small little nerves here that get irritated and compressed. And one of the most important ones is when our head for lengthy periods of time stays collapsed down, is it stresses and narrows off the normal blood flow our arteries should give to our brain. And I see this more and more over the last, I would say, 8 years in clinical practices, people coming in specifically more for neck and shoulder injuries, where in previous years it was more related to lower back injuries, disc injuries affecting the lower region of the spine. But more and more, year over year, more people are coming in to deal with neck injuries and issues. So, the next course of exercise of ones that I would assign to a person dealing with those kind of symptoms of radiating pain into the neck, dealing with more frequent headaches, and also what is connected when the muscles and the neck joints get continually irritated over long periods of time, say like, a year, you don't do anything to try and help yourself, is that the nerves within and around the neck will start to become irritated, and you might start to begin getting numbing sensation or weakness in how your actual hands and arms will perform your day-to-day activities. So the course of exercises that we're now going to introduce are very helpful for freeing back up, changing the neck muscles back to their original state of function, reducing the frequency of headaches, if not completely reducing them all, if your headaches are associated with too much muscle pain in the neck region, which is very common. That will be some of the goals of the next series of exercises. We're going to start by having Ryan here pull his knees right into his abdomen. Then we're going to have Ryan extend his arms on up to the ceiling with his palms up and just very simply twist through the arms till his fingertips point in the direction of his toes. Good. Tuck your chin, flatten your spine, flex your feet, pulling them towards you. Keep the heels connected together and turn the feet into a small V. Perfect. And again, like we've always talked about within the Eldoa exercises, is we're creating a fixed and a mobile point. The legs create a fixed point right here. The arms create the stretching or the lifting point. Good. And again, once you have all those components set up, as demonstrated, begin to hold this exercise for about 90 seconds or about 10 to 12 really deep inhales and exhales. Clinically speaking, as a manual osteopath, what I would walk a patient through is this exact setup. And we might work with this over time in a treatment setup, but how I want you to take these exercises into your life is you'll probably be setting this up with an exercise mat on your floor. Good. Keep contracting the fingers downwards. It's all these small little incremental changes that make the big difference. Now you can't see Ryan's face, but a very important concept in the body is how your face is responding to something. Grimacing in pain is a very clear indicator that your body is doing something it doesn't want to be doing. Versus if you start to gently smile or you feel a sense of ease, those are good indicators that you're on the right path. Now once we get to the end of our hold, just like in the previous exercises, we will slowly relax the arms, the legs, and the position of the whole. Take a few breaths, rest, then begin to either repeat the number of repetitions that's been assigned to you or move on to our second exercise. So, for our second exercise, the lower body remains the same. Our knees will pull into our abdomen. Our arms will start in the position that they just last left. And then we'll take the arms and position them right beside your hips. Keep the tension in the arms. Don't let them just drop to the ground. Keep externally rotating out. Two very important things. Again, we tuck the chin. We keep the knees, feet. Good. And then keep pushing the arms downwards as you keep tracking and pushing your head upwards. Very important, especially if you're dealing with sharp, nagging pain that radiates across the neck, if you're dealing with limited mobility in the arms from your hip to about over your shoulder height. So if you're somebody that's having difficulty right now taking a shirt off or putting on a jacket, that's another good indicator to use this exercise. And again, once you're set up, big inhales, big exhales, holding for about 90 seconds. Or if you've been assigned a different amount of time because of how your unique injury is affecting you, you work with that. Good. And then we'll slowly start to release the exercise. And again, I always stress, release the exercise slowly. Then you can relax. Take a moment to breathe, rest, reset. Good. Yeah, I know these are great ones, eh? Yeah. Now we'll move to our third exercise to help to reduce text neck, but it will help clear up a whole plethora of aches, pains, and injuries that affect the mobility of your shoulders and your neck. So the legs will remain the same. We'll draw them back into the abdomen. We'll extend the arms back up to the ceiling, palms up, fingertips to the sides of the room, and just very simply extend the arms almost straight back or to what your distance of comfort is. Good. Flex the feet towards the shins. Perfect. Good. Personally, this is always a go-to exercise that I assign to every client that I begin working with. It has a number of benefits in how it helps to improve the alignment of the entirety of the joints of the spine. It offers an array of benefits and improvement to range of motion in the shoulder joints. Good. And you can see he's got this gentle smile going on. This is a good one for Ryan. Good, yeah. And you might notice as you're practicing your Aldoas that you might notice shaking or a number of different types of sensations going on. Again, reach out and you can ask me about clarifications on all these different ones because everybody has a different reason why they've got going on certain things. Big inhales, big exhales. Again, always be tight with those angles in the wrists. Think about Spider-Man's hands is what I often talk about with people. The tighter those angles, the more efficient it's winding up the body and the better it's going to be at reducing your pain. But bigger than that, actually correcting how the joints are moving in relationship to each other. Good. And then, as we always say, slow release of the arms, slow release of the legs. For our fourth exercise, again to help reduce text neck and improve our shoulder range of motion and a range of other things, again we're going to draw our knees back into our abdomen. We're going to extend the arms on up to the ceiling. Now, in order to, as efficiently and as accurately as you can, set this up for your home practice, from this position, open the arms to a T. Second to that, you want to externally rotate through the arms so that your fingertips will point in the direction of your toes. Then from here, you're going to bring the arms up to this Y position. Again, a way to think about it is from the elbows to the ears to the armpits creates this triangle. Another way to look at it is if you put a protractor on your chest, your arms will angle to about 120 degrees. And once you have this set up, big inhales, big exhales, holding for the duration of time either you've been assigned or our basic 90 seconds. Good stuff. Chin is tucked, low back's flat, keep drawing the knees in. Always keep scanning through your body as you're doing these positions for anything that you're subtly losing in the integrity of the position, because it can become fatiguing over time, and you want to, as best as you can, hold on to the accuracy of the setup of the position. Last few breaths. And then again, just like with all the previous exercise, slowly release them. And that will conclude the cluster of exercises that you'll notice will help you reduce headaches that are being caused by your neck muscles being too tight. You'll find much of the nagging and irritating pain that radiates across your shoulders at the end of your day will completely disappear. And you'll notice if you're dealing with slight tingling or numbness in your arms because of just years of amounts of tension and rigidity in your muscles, many of those things will start to clear up.